Good morning, Dr. Ericka Mizuta here. So it's 2024. I have a lot of patients that have already made New Year's resolutions and or goals, and they have decided to get rid of them. And it's January 9th today. So 9 years into the new year and they're done. And I wanted to talk about that. One of the reasons why a lot of people don't stick to goals is because there actually is a scientific way to make goals and or resolutions and to stick to those. So there's a podcast that was done by Jay Shetty, and I'm going to link that podcast, which talks about this research. And basically what it does is it breaks down goal making or years or months or weeks into 4 different categories. And so you need to do them in this order in order to be able to stick to a goal. So the process, and I'll give you the list of 4, and then we'll talk about it. When you're making a goal or resolution, you have to go through a learning phase, right? Because, if you want to have a new exercise program or a new eating plan, you have to learn about that plan and to know why you're doing it in order to implement it. If you just say, I'm going to stop eating sugar, but you don't really understand your why very well, it's really hard to stick to that new goal. And so I work with patients a lot in physical therapy. And, when you give a patient an exercise for whatever specific problem they have, one of the things you do is a lot of patient education. So I'll pull out, a model or a picture or, whatever it is, and they understand what their issue is. And then they understand why and how that exercise is going to help them. So when patients understand that, then they stick to their program. If they don't, you just give them a bunch of exercises to do, they're never going to follow through because they don't understand what's important, what's not important. It's too much. They just get to the point where they can't do it and they quit. So the first part of making any goal is learning. So what you might need to do with your New Year's resolutions is you need to go back and say, okay, what goals did I make? And if I'm not sticking to them, maybe I need to go back and I need to relearn. So, and before you even implement anything, you might need to have 2 months or 4 months or 6 months or sometimes even a year of collecting a lot of good information and learning so that you can then experiment and start to implement these goals. So the first part is learning. So if you're not sticking to your goals, maybe you need to back up a little bit, look at your goals and say, what do I need to learn about these? What is my why, right? We have to have a good why. And then you can start to implement it. So the second part of it is experimenting. So for example, we're going to be talking about the American College of Lifestyle Medicine 6 pillars for the next few months, because these are the 6 things for optimal health that you need to address. And for example, one of them is alcohol and substances, right? Why you should not use risky substances. Now, some people have zero problem with this, but I feel like now there's a lot of problems with social drinking, which is one of the things that I will address. And there's a lot of new research coming out of Stanford about alcohol. And what they've done is they've done a lot of brain MRIs on people that drink, whether they drink a couple of drinks a week, 5 to 10 drinks a week, whatever it is. And they're seeing in these people that are drinking that there is brain degeneration. So there's a lot of new information out there, right? So that's part of the learning phase of that alcohol goal is if you understand what it's actually doing to your body, then it's going to make it easier for you to stick to the goal. So the second part of sticking to a goal, once you've learned about what it is, right, is experimenting. So experimenting is where you're going to start implementing some of the things that you have learned, right? Experimenting and seeing how your body feels. So for example, with the drinking goal that we'll talk about, it's like experiment. And if you don't have a glass of wine at night, see how you feel the next morning when you wake up. And a lot of people will say, oh my gosh, I feel so much better. I don't have brain fog, or I could get up way easier and not hit snooze and I could work out in the morning. So that's the experimenting part of a goal. Then you get to the performance part. So that's where you really got this goal on lock and you're just performing it. You're consistent over and over and over again because you've learned about it. You experimented what worked for you and how to implement it. And now it's easy and you just perform it and you keep doing that. So once you get past those 3 phases, the 4th phase of that goal is thriving. And that's where you're really going to see all of the benefits of the goals that you've set. And you're going to feel good about it. You're going to feel, your body's going to feel better, whatever it is that your goal is. It could even be like a financial goal, right? That you're trying to save more money and you see your bank account, growing and that you're funding your retirement or whatever it is. But that's where you're in the thriving phase. And that's because you went through the 4 steps. You stepped through learning, experimenting, performance, and thriving. So where I find that most people fail with goals is they have skipped those steps. So I'll link the podcast if you want to listen, but if you don't want to, you can just take what I said and we need to go back and relearn about those goals, then experiment with implementing. And once you find what works, then you do that consistency, which is your performance, and then you're going to have a thriving part. So stay tuned for more videos on optimal health and what we're going to do from the American College of Lifestyle Medicine this year to achieve optimal health.